Thank you everyone for being here. It's a great pleasure to having all of you come and listen to this presentation. And thank you, of course, to Reach Edmonton and the City of Edmonton and the partners for being willing on such short notice to put something together. We're very pleased and happy that you're doing this on behalf of the Canadian Municipal Network on Crime Prevention and on behalf, of course, of the 40 Days Safer Cities Challenge. My name is Felix Munger. I work with the Canadian Municipal Network on Crime Prevention for about 5 years. Without any further ado, I want to hand over the microphone to Jen Fox from Reach Edmonton to start their presentation. And thank you, Jen. It's really great to see you doing this presentation.
Thank you, Felix. Just before I begin, I just want to say thanks to Felix for all the work he does for the Canadian Municipal Network on Crime Prevention. And I am the proud co-chair of that network. So please think about joining if you haven't already. I also want to do our land acknowledgement. Myself and my team from Reach are currently on Treaty 6 territory, which is the proud home of the Cree, the Métis, the Saulteaux, and the Nakota Sioux. And we always like to end by saying we are all treaty people, to think of this as something we work in reconciliation together. So we are going to do a very fast-paced presentation for you today, but just to begin, I want to say how proud we are to participate in the 40-Day Safer Cities Challenge with our UN Habitat partners. We at Reach, along with our partners at the City of Edmonton, are also proud partners of the Peace in Our Cities movement, for anyone who might be joining from that. So today, as you can see from the opening slide, our presentation is entitled Community Safety and Data-Driven Futures. So we're gonna highlight some of our initiatives that shows this work, but I just want to tell you a little bit, for those of you who are not familiar, about what Reach Edmonton is. And to debunk any myths, it is not an acronym for anything. It's more about reaching into the community, being part of the community. So we were established in 2010. We were established as a result of a task force work. The mayor and council had heard a presentation from Irvin Waller, who many of you will know, who was a noted criminologist, formerly from the University of Ottawa. He came to the City of Edmonton and told them that municipalities that invest in upfront community safety strategies could save between $1 and $20 down the road in various other costs, emergency services, prisons, mental health, all of those things that you're familiar with. And they were just very taken with this. And so they created this task force that really extensively engaged Edmontonians, hundreds of Edmontonians representing many groups, including those with lived experience. And the decision was reached, the recommendation was made, and the decision was reached to create a standalone organization called Reach Edmonton Council for Safe Communities. We are very unique in that we are an arm's length organization from the city, but we are also a not-for-profit. And so I report to a board of directors and not to the City of Edmonton, which allows us to be more flexible and responsive to better address those community safety needs. And I'm very proud of the City of Edmonton, who invests very heavily in community safety. And we're finding during COVID and some of the major discussions around diversity that this has been an incredibly important way forward. Our goal is to make Edmonton safer within one generation. You can, yeah, thank you, Christy, just keep moving these slides. I'm going to go through them quickly. Safer within one generation. And what's really important about the one generation is that we're not about quick fix solutions. We're not about Band-Aid solutions, but really more about, we're in the business, as the slide says, of systems change. We do that by getting groups, organizations, agencies, businesses to work together better and differently to solve complex challenges. So you can see there too on the slide that we are about creating a vision for community safety. We're really about aligning activities towards that common vision. And we're going to talk lots next about the next bullet, which is establishing measurement practices to evaluate our initiatives. Everything we do is based on fact, on research, on evaluation. We're really proud that we are nimble and flexible, and when we see that something's not working, we can quickly change it. And I think my team will talk to you a little bit about that today when we talk about the crisis diversion and other initiatives. So we are a backbone organization, so we do not do frontline service delivery. We're not a funder, but what we try to do is notice where there are gaps in service delivery and help our partners to mobilize funding for those initiatives. So I'm going to move. I really don't want to spend too much time on this because really what we're about here is this presentation is advancing data-driven decisions. And I'm so very pleased to introduce, first off, to begin the discussion, is Emma Potter from the Canadian Mental Health Association, who's going to describe the 211 initiative. And this partnership has been long and strong, and we're very proud of it. So I'm very happy to welcome Emma.
Thanks so much, Jen. So as Jen mentioned, I'm here representing 211. So 211 is a program that in Edmonton is run through the Canadian Mental Health Association. We cover Edmonton and all of Northern Alberta. 211 is across Canada in all communities now. We're really excited to say that. And what we do is we provide a free confidential service that is connecting individuals in community to a wide range of community, social, health, and government services. We're really all about making those connections to the services that people need when they need them. Here are some quick snapshots for us just here in Edmonton, an example of some of the data that we collect. We collect so much here at 211, but as an example, so far this year, we've taken over 60,000 contacts. 48% of those are outside of regular business hours. And that just underscores the importance of some of the work that we do in being 24 hours, reducing barriers and being accessible to people. And I think that shows in the numbers. Because we are connecting people to what they need in the community, a huge component of what we do is track the needs in community. So you can see so far this year what has lifted to the top. I know for me that is no surprise. Given what we're going through with COVID-19, that crisis intervention, information, income, emergency shelter. And later on, they're going to talk about our role in the crisis diversion partnership. And so local transportation lifts up in that space as well. Next slide, Kirsty. And so we collect a ton of data. We collect data on our volumes. We look at what are the needs that are met in community, what are the needs that are not met in community. And a part of the way that we do that is we collect all of the information about what community and government's resources are available in community. We can map them, we can track them, we can say who's calling about what in what geographic area. We can look at where are the referrals going to and coming from. We collect a lot of geographic and demographic data from people using postal codes and geotagging. And we also, of course, as everybody does, look at outcome and satisfaction as well as performance metrics within our system. We are blessed by being a phone, text, and chat service. And so our staff are sitting in front of a computer and they can type a lot of things in and collect a lot of data, and we can automate a lot of data within the 211 system. So we have a lot and we want to use it for the good of our community by sharing what's going on. We're really quick and nimble in terms of identifying what are the trends that are happening around what people are asking for, what services are available or not available. We spend a lot of time working with our partners, including the City of Edmonton and Reach Edmonton, looking at the geographic breakdowns and the demographic breakdowns of what are the needs for the seniors population? What are the needs for families and children and youth? What's going on with our homeless and vulnerable population? So we don't want to hold all of our data for ourselves. We want it to be open and accessible so that others can find out what we're hearing in those over 60,000 interactions and over 16,000 resources in our database. And I think that's the end of my slide. So I'm going to hand it off to Jim from Reach to talk about the ArcGIS system.
Thanks, Emma. My name is Jim Zhang. I'm the data storyteller from Reach. Please go to the next slide. So the project we are closely working with 211 is the 24/7 crisis diversion. This is the team we use to help Edmontonians who need non-emergent help. We have 6 teams working 24 hours a day, 7 days a week. And this project is becoming more and more important to us and to the city. So we are thinking about improving the technology they use. The solution we come up is ArcGIS System. ArcGIS apps are designed for field operations to do data collection, improve coordination, and achieve operational efficiency. And this system can be used on multiple platforms, the desktop, the smartphone, and the iPad. Please go next slide. Yes. So the overall workflow of 24/7 crisis divergence is that when clients need help, they call 211 all the teams. Then the team and the 211 communicate with each other. They create a dispatch. They will drive to the event location, help the client do the data collection, and in the end, we do a one monthly report for the leadership. So follow this workflow, we have this system. We use ArcGIS Workforce to do the dispatch. Then the ArcGIS Survey123 to do the survey, to do the data collection. And we use the ArcGIS Navigator to do the navigation. And in the end, we have ArcGIS Operational Dashboard to do the data analysis. Yes, the first most important app we use is called ArcGIS Workforce. This Workforce has two versions. The first is Workforce web version. We use this to create a dispatch to the field workers. And the second version we use is the mobile app, Workforce mobile app. This is the teams to accept or refuse or reset the dispatch. So all the apps, including Workforce, Survey123, Navigator, and Operational Dashboard, can integrate together to serve the field workers. Please go next slide. Thank you. This is how it looks like. So the left picture you see, on the top, there is a blue button called Create Class Assignments. So when there is a new assignment, a new dispatch, they just click this assignment, enter all the information, including the event date, time, location, detail. And on the right side, you can see a map. This is showing where the teams are on real-time tracking. So they can decide which person or which team to assign based on their location. So once the dispatch is created, the team can use the mobile app, which you can see in the right bottom corner picture. There's a mobile picture. So they will get notified the team, like you just get assigned a new mission, and they can click on checking the information, all this, then they can choose to accept the mission. Please go next slide. So the second most important part of our operations, when the dispatch is created, they will drive the location, help the person, then they will need to do the data collection. Survey123 is one tool we use to do data collection. For now, we are collecting two kinds of data. We collect first is the event information. We collect what time, date, what location, what service we help, and the detail of each service. The second type of data we collect is client information. We collect their name, their date of birth, their contact information. So in the future, if needed, our social worker can contact the clients. So this is how it looks like. So the picture in the bottom shows you how we create assignment. So this is a survey we can create in the web version, and it give you automatically analyze like the percentage of yes or no, percentage choose, someone choose A, someone choose B. We can always check in how the answers are going. So we also can check this survey in two parts. So first, we can share the link, opening a web version. And we also have the mobile app to actually do data collection in the field, which you can see in the right bottom. Please go, yes. So the third app we use is called ArcGIS Navigator. When a dispatch is created, use Workforce, they do data collection. In the between, we need to drive to the location. So instead, we copy paste information, then go to the next slide. Yes, this is how it looks like. So when Workforce is created, the team will get notified on their mobile app. They just click a button called Navigate to this location, then this will show up. The good part is that we can pre-enter all the locations of this mission. We can enter multiple locations. Then when they click the button, they directly show you the route to each location and also the time it used. Then please click the next slide. Yes. So this is overall the flow. We use Workforce to create the dispatch. We use Navigator to travel to the location. Then we use Survey123 to do the data collection. In the end, the most important part is that we need to do the data analysis, use the data we collected. ArcGIS Operational Dashboard use the data field workers collected through Survey123 to create real-time update dashboard by seconds. The dashboard can show the total numbers, client 24/7 helps, the location of teams, and the detailed information of each dispatch on real-time updates. Please go to the next slide. So our project in the final stage before launch. So this is a template with Azrael, the developer of ArcGIS system, used to show people how this works. As you can see, this dashboard is from the Philadelphia crime dashboard for police chief. So this dashboard is highly customizable. You can show any type of information you need, especially in the middle part. There's the map. The map shows real-time track information of each event and also the team. And this whole dashboard information changing by seconds. Every time a team uploads information, this will change. And we can put this into a web, our web or any to share with our leadership so can check it. So this is our overall ArcGIS system. We create dispatch using workflows. We use Navigator travel to the location. Then we do data collection due to the Survey123. In the end, this operational dashboard will do automatic on real-time update data analysis. Thank you. So next part is Chris' part.
Thanks for that, Jim. Good morning, everybody. Man, I can't stop listening to Jim talking about ArcGIS. This is a really powerful development for REACH. This is a type of technology that you wouldn't normally see in organizations the size of REACH, and it's really going to bring value to the front staff who will benefit from increased safety, and to the clients who we serve, who are really, this is going to really increase our efficiency. So I'm going to talk a bit about the Community Safety Deployment Dashboard, which is a project that I'm managing and a project that REACH is a really central partner in. So, you know, the reality is that public safety is a #1 priority here in the city of Edmonton. But with an economy reeling from the impacts of the pandemic, the dollars that we have available are really strained. Here in Edmonton, we're anticipating that over the next 50 years, we're going to see our population double from a population of 1 million to 2 million people. And when you combine all those factors together, what you're left with is an approach to deployment that is simply unsustainable. And that's where the Community Safety Deployment Dashboard comes in. We have to really reimagine how we deploy resources, and this is part of our solution. So what we want to do with the deployment dashboard is to deploy the right resource at the right place, at the right time, with the right information for a safer city. At heart and soul, what this is data-driven triage. Now, in order to deploy the right resource, you need to have the right partners. And you know, we're so fortunate to have REACH as a real leader in this project. So we're accompanied by 5 partners. We have REACH through the 24/7 crisis diversion team. We have the Edmonton Police Service, and then we have several City of Edmonton partners. So we have our community peace officers, we have our transit peace officers, and then we have our corporate security folks. So there's 2 ways that these folks participate in this project. To participate in the dashboard, people give their data, so all of their demand data, their call for service data, and they also commit to deploying based on the insights of the dashboard itself. Now, we are now in production. We launched the dashboard back on September 15th. Just a couple highlights of this project. The first one, this is so topical right now. We are, and it's very positive, data ethics and data and analytic ethics and privacy considerations are really top of mind for organizations like REACH, like the City of Edmonton, the Edmonton Police Service, and frankly, like for our citizens. Projects like this often conjure up thoughts of like movies like Minority Report or Moneyball. So it's really important that we approach these projects with ethics baked into the very front end. And to that end, what we've done with this project, the entire model is built just on 3 factors. So the time of a location, the time of an incident, the location of an incident, and what that incident is. So there's absolutely no personally identifiable information here. Nothing on race, nothing on age, nothing on the victim or the offender. It's really built on those 3 things. And just as a highlight here, what we've done, we have a very skilled data scientist working on this project. We've done early testing that shows that our predictions are 9.5 times more accurate than random deployment. And what that means is if you were, say, the Edmonton Police Service, and you had a beat contingent, and you were able to deploy those resources, this is almost 10 times more effective than just doing so based on gut. Just one last point there. COVID has really changed the game for us. This is not our first rodeo. We've built models like this before. Normally what we like to do is look at the previous 2 years of historic data, really to get the best bang for our buck in terms of those predictions. But we all know that what was a reality 2 years ago just frankly isn't a reality now. Community safety has changed dramatically. So what we've actually done through our testing is we found that it's the last 2 weeks, of activity that are the most effective way to base our future predictions. And what you're left with then is a model that is very flexible and very reactive as to what's happening now, as opposed to what happened 2 years ago. Here's a screenshot of the dashboard itself. I could walk you through all the features. I don't know if we have time, but the one thing that I do want to point out is that our predictions are really twofold. So what we've done is we've split out probability and severity. And what probability is, so this is a lot of data. This is by definition big data, and we get this data refreshed every day at 5 in the morning. So probability is it's about the likelihood of something happening, anything happening. This could be about crisis diversion. This could be about homicide. It's just that something's going to happen there, and you'll see those reflected in the Tetris-like squares up on this image. So that's predicted across the map. The other really important feature there is severity, and you can see that in the upper right-hand box. And that is, okay, we're confident that something's going to happen, but based on history, what is likely to happen there? So when you click on those Tetris-like grids, that's the pop-up there. And what that does is it empowers our partners to say, well, we know that something's happening. Are we the right organization to be attentive to that? And they can pull it up, they can look at historically what's happened there, and then they can discern whether or not they should be attending to that. Just one last point, this is not a dispatch tool. So when someone calls our crisis diversion team, when someone calls the Edmonton Police Service with a 911-like concern, this doesn't interrupt that at all. Think of that as the peak. This is a valley solution. So this is the tool that you would consult in between calls. So what we would call proactive or problem-solving time. So when you have some downtime in between calls, where do you best position yourself to take a preventative approach? And that's really what this tool is intended to inform. So that's the Community Safety Deployment Dashboard. I'm going to hand it over to Madeline now.
Hi, I'm Madeline Smith with Reach Edmonton, and I've been working on the 24/7 crisis diversion program for the last 7 years. This service diverts non-emergency crisis events from the police and medical services to an outreach team. So it's built on the premise that when people are in non-emergency crises, they do not necessarily need the police. They do not necessarily need the ambulance. They need the best service at that moment for them. And so this is what the program does. It's in the field 24 hours a day. 6 teams rotate through different shifts, and they are there to respond to the needs of those people who are on the street or are those that are referred to us from 211. Next slide, please. This is a really important partnership. And because of the leveraging we were able to do with our partners, Boyle Street Community Services, a well-known street outreach speciality in the city, Hope Mission, the largest shelter in the city, Canadian Mental Health Association, 211 with its information and referral service, Edmonton Police Services, Alberta Health Services, Reach Edmonton, and another piece that's come on board very strongly this year has been our peace officers, particularly in regards to transit. And so this partnership comes together to bring all of these folks together to do something different with people in regards to non-emergency situations. Next question. Our social return on investment is $1.91, which saves for every dollar invested, we bring back $1.91 in value. We also, when we speak about what is our contribution to the police, we are talking about time, and time is the most important value in regards to engaging with emergencies, but also engaging with those people who are unsafe situations on the street. And so that's 36 minutes. So in 2019, we saw a 22,528 overall crisis events. Since 2015, when this new iteration of the program came on the street, what we saw, we've been engaged in over 57,000 events with the folks on the street. And of those people, there are our unique clients. And those are the folks that frequent our program often. And that is a really important consideration when we start to talk about data. Next. In regards to our referrals, 211 plays an incredible role. And in the initial part of this program, most of our referrals came from the police and emergency services. But over time, and with a very simple, inexpensive social media program that lasted about 3 months, we began to build that community space for Edmontonians to know, call 211 instead of 911. So today we look at the average referral from from their service to our program is 70%. So that is an important system change when we consider the impact of this program. And again, we're talking about those frequent users of the program. And we can go to the next slide. What is most important about the data in regards to this is that when we look at the people who are using our service over and over again, they are telling us a story. And that story comes through the data. It also comes through the qualitative pieces that we pick up with our workers. But through the data, we understand more clearly what are the trends with those people. Recently, we were speaking at our steering committee meeting that what we've noticed is younger and younger people are now having more crises. And we're noticing that many of them are female and Indigenous. That's a very important trigger for us in regards to how can we inform the system so that those services become more available and prominent in our community. I'll just finish with the demographics. Another piece that it informed very importantly is Edmonton went through a downtown revitalization where we had a particular intensity of need in the inner city. As a result of that, people moved out of the city, and that created a disbursement of need throughout the city. And before, it was always believed that we had to concentrate all those services. Well, from 24/7, we were able to tell the story that, look, people have moved out and there's need throughout this community. And so when we talk now about shelters, we're talking about dispersed models, and that's how the data has affected. So a big piece of this work is absolutely how do we meet the needs of those that we are serving, but also how do we impact the larger system to inform it so that decisions can be made that are going to meet those needs, and hopefully work with people to keep them safer. I'm going to pass this back to Chris.
Yeah, I would just say in closing that, a data-driven future is all about culture, and culture is not achieved by boiling the ocean. So what we hope that you see here is that, we're starting with small and winnable, and we're going to show how that is reflected in our programs here, and then take it on a piece at a time. So really appreciated everybody's time. We know how incredibly busy all of you folks are, and just let me see here. And just happy to take any questions now at this juncture.
All right. Thank you, Chris, and Emma, and Jen, and Jim, and Madeline for your presentation.